I'm Dr. Ken Blumenthal from Allergy Asthma Care. Today we're here to discuss the proper use of metered-dose inhalers for treating asthma. This is a metered-dose inhaler, and all metered-dose inhalers work about the same. There's a canister that we push down to activate the medication. The whole purpose of using a metered-dose inhaler is to get the medication deep within the lungs so it can be effective and treat your asthma symptoms correctly. There are different choices in metered-dose inhalers, both controller medications such as this to control your asthma symptoms, and rescue medications such as this, which could be used on an as-needed basis for symptoms such as wheezing, coughing, or shortness of breath. There are also dry powdered inhalers such as these, which do not require use of a holding chamber. These are easy to operate by opening them up, clicking, putting them in your mouth, and sucking deeply, and then holding your breath for a count of 8 to 10 seconds. But today we're going to concentrate on the correct use of a metered-dose inhaler such as this. And they all work very similarly. When we push down, a puff comes out of medication. Studies have shown that these medications are best used using a holding chamber. Studies were done with all these medications by spraying this in the mouth directly. However, we have found repeatedly that using a chamber such as this increases the benefit of these medications in 3 different ways. First of all, it leads to better deposition of the medication in the lungs and not in the upper airways. By getting the medicines in the lungs more efficiently, we're able to use less medication and have better results. The use of these chambers also lets us have more consistency so that there is less dose-to-dose variability. Without using a chamber, there is quite a bit of variation in how much medication actually gets into the lungs from one use to the next because of improper technique. The third and important benefit is that it minimizes the amount of medication that is deposited in the throat, thereby minimizing any chance of developing oral thrush when we're using controller medications such as this. So what I would like to do today is talk a little bit about your typical valved holding chamber. This one is called the Vortex. Our office also recommends the use of an aero chamber or the Opti chamber. They all work about the same. They're easy to use and require very little maintenance and care, and they're easy to clean and last a long time. They can be opened up easily and cleaned out very simply with soap and water, or even put in the top rack of a dishwasher so that they stay clean and fresh for many, many months. To use a chamber, we basically take the inhaler and place it on the end. Most medications require that they be shook up prior to use, and this can be shook up prior to putting it in the chamber or after putting it in the chamber. However, this particular medication doesn't even require that. Simply, we push down and slowly inhale. The best technique is to take a slow, deep inspiration and hold your breath for a count of 8 to 10 seconds and slowly exhale. Breathing in too rapidly or panting when you're breathing leads to less medication getting in the lungs and defeats the purpose of the chamber. Let me demonstrate proper use. So to review, before spraying, we exhale fully. We can put our lips around the end of the chamber at that point and then push down on the inhaler to activate the metered-dose inhaler. Once the metered-dose inhaler is activated, we immediately suck in a deep breath. I'll demonstrate again. This is always followed by a breath hold of approximately 8 to 10 seconds. These medications are simple to use, they're easy to maintain, they're easy to clean, and they will lead to much better asthma care with proper use by delivering the medication where it belongs, which is deep within the lung tissue and not in the upper airway, and chambers help make that possible. We do not recommend the use of metered-dose inhalers except with some type of holding device because of these reasons. We also have dry powdered inhalers, one such as this called Advair or Asthma or Pulmicort, which do not require a chamber and actually should not be used with a chamber. These can be activated simply by clicking and taking a deep, strong inspiration and then holding your breath in a similar manner for 10 seconds. When you receive a metered-dose inhaler, most of these have to be primed with approximately 4 puffs. This only needs to be primed initially when you first receive the inhaler, and afterwards you don't have to prime it again. Most of the chambers have anti-static linings. However, it is still best to prime it within the chamber so that it coats the chamber with the medication. You will need to reprime it once you replace the inhaler with a new one. Most all of the inhalers have some counting mechanism to tell you how many puffs you have left. They also start at 0 or -4, taking into account that you will likely need to prime the medications. Some of the counters are on top, some of the counters are on the back. However, they are all fairly easy to read and will let you know how much medication is there. With proper use of your meter dose inhaler and aero chamber, you will find that your asthma will be much easier to control. More medication will end up where it belongs in the deep part of the lungs with less chance of any side effects. These holding chambers really increase the effectiveness of these medications, and at Allergy Asthma Care we are strong believers of using some form of chamber when using a meter dose inhaler to effectively control your asthma.